it's the first time that all WHO member states have formally recognized skin diseases as a global public health priority. And I must say, this is really a game changer for visibility, funding, and action, and something that's important for patients suffering from skin diseases worldwide. So I could say, yeah, it elevates skin health on a national and international agenda and paves the way, in fact, for coordinated action, funding, and policy change down the line. And that's really the objective. Yeah, they affect nearly 2/3 of humanity, and I don't think we realize that. So each year, over 4.6 billion patients are affected by skin disease, and this has been also calculated what it implies as far as cumulated life years of disability, and that is 41 million cumulated life years of disability every year. And this is associated with stigma, these skin diseases, and significant mental health impact too, alongside the suffering from the skin lesions themselves. So yeah, skin diseases are one of the top 10 causes of disability, and that's been published and known. And one must say, historically, skin diseases have too often been seen as cosmetic issues, leading to underinvestment despite their profound physical, psychological, and economic consequences. And something has to be done about that. We have to realize that the disease goes beyond the skin in several patients. You can imagine patients suffering from vitiligo or white spot disease. This is quite frequent. They're really discriminated and they're suffering a lot. That's just one example, but there's lots of others, be it infectious skin diseases such as fungi or tinea, which is very frequent in parts of the world such as Africa. Yeah, the burden is really high and there's something to be done, and the neglect is due to historic reasons, but also because several of the skin diseases are not directly deadly within a short period of time. Yeah, well, the resolution is a blueprint for action, meaning as action, I mean training care workers, improving access to care, expanding access to diagnostics and to treatments, strengthening surveillance, and really embedding skin care or taking the care of patients suffering from skin diseases into every country's primary health system. So that's really what has to be done in practice. And I would say this will guide national funding priorities. It should ensure that skin diseases are included in universal health coverage, and in developing the essential medicines list of the WHO to make sure that really essential medicines are available everywhere on our globe. Yeah, so I've served as a president of the WHO Committee of the ILDS for the 12 past years, and we've been working really hard together with the WHO to move towards this goal, which we've now achieved, having a resolution that's been accepted. The ILDS, or International League of Dermatological Societies, is the only dermatological player that is in has a status of official relations with the WHO, which has been renewed every 3 years due to the amount of work we're doing together. And yeah, our role is to represent dermatology and skin health within the WHO, and also in the context of this resolution to be a bridge between dermatologists, governments, and the WHO, thus turning global policy into local progress that can be felt, especially in the places that need it the most. So we really will need sustained investment and partnerships to turn the good words of the resolution into better care. But I'd like to be optimistic, and we've already started really working and planning this out with the WHO and seeing how we can engage at a policy level with other partners and with funding partners. But I would say in 5 to 10 years, I would like to see skin health in primary care everywhere. I'd like to see stigma for patients suffering from skin disease fade in a measurable fashion, and to see billions gaining access to the treatments and dignity that they deserve. I think those are our main objectives, and they'll be measurable. They'll be measurable if we manage to move in that direction. Yeah, you know, 5 years ago we were discussing this, and in parts of the world there's no Wi-Fi, so we started preparing educative materials that are printed out on plastified paper that you can really bring to field workers who are not even trained nurses. These are just people who have very little know-how but can help in triage or help treat the more simple, frequent diseases if you provide them with very simple guidelines with images, how to diagnose the disease and what are the first steps that have to be done and what are the cases that have to be sent to referral centers. Nowadays, the Wi-Fi is much better. And so online, we're developing online programs, collaborating with companies who have developed good online platforms, but also with the WHO and the Neglected Tropical Disease Department. They're developing their own AI. We're providing images from around the world, also with skin of color, so that this can be used on simple phones on the field for diagnostic purposes and also to help define what would be an adequate therapy. So I think alongside training, and we're doing a lot of online training, there's also this aspect of assisting with diagnosis using modern technologies.